What's up, everybody? Dr. Shadi Rafich here, board certified veterinary surgeon. Take a look at this shirt. Classic or what? Huh? Marvel, Spider-Man, and can anybody name who this villain is? Huh? Put in the comment section or whatever below this video, and we'll see if anybody can guess the appropriate name here for this creature. Look at that. Look at that. Anyway, glad you're joining us. We're going to be talking about behavioral issues in dogs and cats. I'm going to talk about how to think behavior in sort of a grand scheme of things. We're not going to go into too much specifics with every single detail. That depends on your relationship with the veterinarian and the specific scenario. But let's talk about behavior. Let's talk about what causes behavior abnormalities in animals, and let's talk about some broad treatment options for those pets. So let's get into it. So what causes behavior problems? Well, it's probably one of two things. It's either going to be some sort of psychological issue, or it's going to be some sort of metabolic issue, right? Psychological being something, of course, in the brain, either it's previous trauma or it's actual disease of the brain itself that is a natural deterioration. And then there's the physiologic part, where there's some sort of actual disease that's affecting their behavior secondarily. So it's not an emotional thing or psychological thing, it's an actual like hormonal thing. And so when you talk about psychological thing, you're thinking about, okay, well, previous trauma makes sense, obviously, and if you're talking about something that's sort of altering their state of mind, things like, for example, we see dementia in dogs as they get older, which is analogous. We try to make it analogous, like Alzheimer's disease or going senile, so to speak. And so those are two very common reasons for sort of a psychological problem, with probably the previous history of trauma being the more common, especially now that more and more people are adopting pets from shelters and rescuing animals than getting them from breeders. So we've always seen a lot of these types of problems in dogs. So if you're in one of those categories, then you're looking at ways to changing the behavior. And of course, the treatment for those two categories are going to be different, obviously. Because usually if you have a dog with some sort of emotional, psychological trauma, they will probably be younger dogs that you're trying to fix to make them an adequate companion in your household and not worry about anybody getting bit by them, right? And make sure they're enjoying their life with their humans at home. And so you're looking at things like training them, behaviorists. You either go to somebody who's not a veterinarian or medically trained, but they're very, very good at behavior. And of course, there are actually board certified veterinary behaviorists that you can find in most colleges, veterinary schools. And I'm sure there are some out there that have their own business going. Those are probably your two options for looking at how to alter the behavior. There are, of course, some people out there, there are pet owners that just learned over many, many years of owning pets how to train them. Good, great. And I'm sure now with online videos being so prominent, you can go online and search something and how to do it as well. It is by no means an easy process, that's for sure. Anybody who's tried to change the mentality of a dog, it takes time. It's tough, and you have to really be dedicated to that pet and to the end game here, which is to get your pet as socialized as possible. At the end of the day, there are some pets that just can't be fixed, and that's a different problem. Not every dog with prior trauma can be remedied, but a group like Best Friends Animal Foundation, of course, they actually are really good at trying to train dogs that are deemed untrainable. But that's just one example of an organization that'll take these sort of lost causes and try to rehab them and make them adoptable. So behaviorists figure out what is the issue with that dog, previous trauma. Maybe through that trauma they don't like children, or they are they're afraid of other animals, or they're protective of their food, or they're protective of a pet owner, or they're just going to have to be the alpha. Whatever it is, fix it with a behaviorist. If it's something dementia related, of course, we recommend either talking to your veterinarian or even seeing a veterinary neurologist. There are certain medications and supplements we can try on those pets if we suspect it is some sort of dementia, and in those cases, get them on treatment, and then go from there. The prognosis, it depends. We don't really know. You just try these things and see what happens, and try to get your older dog back on track to live a happy life, so they're not doing things like bumping into walls or having vision problems or falling down the stairs or just randomly snapping at people or being weird. These are all the behaviors that we can see, some of the behaviors that we can see in dogs that are going senile, that have canine dementia. Then there's the physiologic part, or the metabolic or hormonal, and that's some sort of a disease process in their body that's causing chemical imbalance and affecting the way that they're acting. And that's a very, very complex topic, of course, with many different possibilities. But the reason why I bring that up is because through a careful workup, you can try and figure that stuff out. I've had plenty of pet owners come to me with their aggressive pet and want to blame it on just being a bad dog, and they just want Prozac or whatever, some sort of medication. But if you're trying to actually determine that this dog has a behavioral issue, especially if you've already gone down the behavior training route, then we need to figure out all the metabolic stuff that can cause it. And so a complete workup is necessary. Workups include things like blood work, x-rays, ultrasound, even brain MRI, and try to figure out what's going on with these pets, so we can explain from a medical standpoint what their actual issue is. And then if all those tests are normal, then you say, okay, well then your dog probably has previous psychological trauma, and that's where you go down that route that we spoke about in the beginning of the video. So these are methods. So between your discussion with your veterinarian and your behaviorist, you can figure out, can your dog be trained to be better? Does your dog need behavior modifying medications like Prozac to get them back on track? Or do they actually have a metabolic issue that requires treatment of that to get their behavior under control? And that's a lengthy discussion with your veterinarian, trying to figure out what the best course of action to take is. And at the end of the day, don't forget, there are some animals that you do all the testing, metabolically they're fine. You even do brain MRI, you see a neurologist, everything's fine. You see the behaviorist, and you just can't fix this dog. You're doing medications and whatever to modify their behaviors, and you're just not seeing a response that you like. There are just some dogs that just can't be. And so in that case, find organizations like Best Friends to see if they will take that kind of a pet and try to rehab them. Don't be afraid, of course, if you've tried everything you can. There are some pets that they're not going to be, they're not pets. They just can't be. In which case you need to make a tough decision with that. But the people who have years and years of experience with behavior know how hard it is for you emotionally and how hard it is to turn these dogs around. And I'm sure they've had plenty of cases that seem right off the bat to be sad cases that are not salvageable, and you work with them and they figure it out. So it all depends on your dedication, how much you're willing to devote to this pet to get them turned around. We just don't ever want anybody getting hurt, any child or anybody who's older, a geriatric person getting hurt by a dog because of it. You need to make sure that while you're going through all this, all persons that are interacting with this dog, including other pets at the house, neighbors, things like that, are safe. So I hope the video helps you out a lot. Yeah, we'll see you in the next videos. Dr. Shadi Rayfage. Check it out. A little Marvel action. Tell me who this is. See you guys in the next video.